So one of the big things to remember about cold and flu season is that these are viruses as opposed to what we call bacterial infections. And viruses are really small agents that cause illness in us as opposed to bacterial, which are the types of things that we treat with more like with antibiotics that people are familiar with. But of course, sometimes it's a little difficult to tell, although usually the bacterial ones are usually pretty significant. But the other question that people ask a lot of times is like, hey, how am I supposed to know if it's a cold or a flu? And then, of course, there's always this thing called RSV, respiratory syncytial virus, is also out there as well, which we'll kind of touch on a little bit, but we'll try and focus a little bit more on the cold and influenza. But they're all kind of in the same category of what we call viral infections. The common cold, usually a little more gradual onset. You kind of feel not the greatest over a couple of days. Most people that get the flu is usually pretty sudden. If anyone's ever had the flu, you kind of wake up, you got the chills and fevers, and then a cold is usually a little more mild. You actually tend to not have an actual fever with colds, as opposed to flu, where you almost always have a fever. Sometimes with the cold, you might have a mild to moderate cough, whereas with the flu, typically it's a dry but usually persistent and can get pretty significant. Sore throat, sometimes you can have that, but it's sore throats are usually a little more common with the cold than they are with the flu. And of course, a little nasal congestion is more common. It's the cold. Then you got issues like body aches. So the body aches for a cold usually are very mild if they're at all. Whereas the flu, like people who've ever had the flu, got chills and aches that seem like they just can't make them go away. You really want to be on those covers there. In terms of duration, usually those colds are usually a little bit shorter, whereas the flu is usually a little bit longer there. Of course, your colds usually just rest, where the flu, there actually are some medications you can use if you get them started within a couple of days. Okay. So just remember that the flu, which is a little more severe, you has medication that can use to treat it. And speaking of viral infections that can be treated, we're also going to throw in there that COVID, which I think we've heard of that a time or two. So of course, COVID also has a medication that can be used for it as well.